Fertility Awareness Week, we're taking time to learn about the access to the latest fertility services and current trends in Canada. To teach us more is Dr. Marjorie Dixon, founder, CEO, and medical director of Innova Fertility. Welcome to the show.
Thank you.
So much information to be shared today on, a really sensitive time, but a week that we need to call attention to.
For sure, for sure. And we're elated you're here, Doctor. Thank you very much.
It's a pleasure.
Let's begin with where we're at right now in terms of infertility rates in this country. What are the numbers telling you?
So 15% of the population, of the heterosexual population, is infertile, struggles with infertility to conceive. And that's 1 in 6 couples. And the traditional sort of heterosexist approach to infertility is changing because the landscape of family is very different. So now we have to think of all of those individuals who need the assistance of someone like me, as fertility specialist, to conceive, that's not in a traditional heterosexist relationship. So that's a lot of people.
Yeah, you're so right. I mean, the idea of what is a family and how are families created, it has changed, and so this type of technology keeps up with that. Let's talk about access to it, because access is huge in terms of medical care in general, but for this, something specific as well, the access will be incredibly important and probably challenging.
And that's been a big part of the mission at Innova Fertility, and me as founder, that was from our inception what was so important, because when I came in at the early part of my career, now 22 years ago, it was sort of the typical patients that were coming, and only those who could afford to get to care were getting to care. And it felt like there was so many people who had barriers, implicit or explicit, by the doctors not being able to recognize that they needed to get to care or caring that they did, and the patients who would just count themselves out because they're like, it's too expensive, I can't afford it. Now we have systems. Now we have employers who give benefits. We also have other systems like financing for fertility care. We have funding through provincial and federal levels. So we're really working to advocate for patients so that all Canadians can get to care, because it really is a pervasive issue.
Now, I know there's a lot of people out there who are aware of the options available for people who are having trouble in this area. But I think it's healthy to go through all of them right now with you here, because you're not here every day, and we appreciate you. What are the options available to folks?
So, in as much as the higher level assisted reproductive technologies, there's in vitro fertilization, which people are becoming much more aware of, where we extract eggs from the body and get a sample of sperm, combine them in a petri dish, and grow them in a laboratory. We did a special actually on Cityline about egg freezing. And that's where, because the technology has advanced, we can rapidly flash freeze eggs and then warm them in the future once you're ready to have a child. So more and more individuals are freezing for future use to preserve their ability, because age is a significant factor on determining success in the future. Female age is very important. And then finally, there's a lot, we see the LGBTQSI+ community that is accessing things like gestational surrogacy. So you have someone else carry your baby if you don't have a uterus, or egg donation when patients' ovaries don't keep working because there are limitations to our reproductive lifespans, right? We're considered advanced maternal age at age 35. Doesn't matter what we look like on the outside, our eggs have a lifespan.
And you must be seeing patients coming to you like quite young now too, in terms of getting looking ahead in their life. I've certainly heard about that, even in terms of pop culture and movies. It's getting into that.
It's coming out,
right? Yeah.
I think that what we don't realize is, even if we look around, people don't still talk about it. So we need to destigmatize it. But I know that in this room, if you thought of everybody that's here, everybody knows someone who's been touched and affected. And people still suffer in silence. They come for cycle monitoring, they don't tell anybody about it. They want to wait till they get pregnant before they actually acknowledge that they had a fertility issue. Or sometimes people don't want to talk about it at all. And the reality is that we can't change your fertility. We can assist you. So the sooner you get to care, the better it is. And don't put yourself at the mercy of your maybe family doctor who might not know as much, or you not being allowed to. Patients will say, I wanted to see you a long time ago, but my family doctor told me to try for 2 years before I went. And you can actually come to care. Go online, go to innovafertility.com, and you can set yourself an appointment. We'll arrange to see you to give you the deal, because until you know the details, you don't know what your reproductive ability is. And it's okay to want to know that. That's what this week of awareness is about. debunking the myth that you only come when you're older. That's not how it works. We can do better if you are proactive and come sooner.
Dr. Marjorie Dixon is founder, CEO, and medical director of Inova Fertility. This is a big topic for a lot of families out there. Please come back.
Yeah.
I will.
I feel like we got to keep this conversation going. Thank you, doctor, very much
It's
for
a
being here.
pleasure. Thank you for having me.
All right, we're going to take a break.